This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right. Can you guys see my screen okay here?
Yep, good to go.
Okay, awesome. So my name is Dr. Robert Muselli. I'm one of the PGY4 residents at our hospital. I have the pleasure of being the chief resident. So I'll tell you guys a little bit about us, along with one of my colleagues, Dr. Jerzak, who's one of our PGY3s. So we're located in Hollywood, Florida. It's just north of Miami and just south of Fort Lauderdale. So kind of nestled into a really nice area, regardless of what you're looking for, whether it's outdoors or entertainment and whatnot. We'll get into a little bit of what we can offer in terms of lifestyle. But let me tell you about the people that make our residency what it is. So let me share and make an actually PowerPoint here. All right. So on the left here is our fearless leader. This is Dr. Jeremy Jacobs. He is our program director, and more than that, he is an ortho amputee attending. So he did his PM&R residency in University of Miami, and his focus is really ortho amputee. So he works with a lot of our prosthetics, orthotics, traumatic amputations, vascular patients that come over from our acute care hospital. And that's really what he does on the acute care side. And the rehab hospital as well. And then transitioning over to the outpatient side, he follows them up, and we have our amputee clinic as well, where we work with our prosthetic companies that actually come over and help us learn about gait abnormalities. They teach us quite a bit. So it's a really good experience to see it firsthand. We also have Dr. Delgado, who is our spinal cord injury attending. She is amazing. She's always keeping us on our toes, and she's the one that will be asking you all your questions and making sure that you're reading from Bradham's and Cucurullo on rounds. She'll teach you everything from bowel and bladder to your ASIA exam. And we deal with a lot of really interesting patients that go through trauma on the spinal cord injury service. We're one of the largest public healthcare systems in the country. And so from that, as a level 1 trauma center, we get a number of different patients that you can imagine, everything from gunshots to metastatic cancers that go to the spinal cord. So it's a really good exposure. And then she also has her spinal cord injury clinic, where you do get some exposure to wheelchair clinic as well. So those are really our two leaders and the two people that have built this residency and make it as exciting as it is to come to work every day and learn and be excited about what we do. This is us working with our orthopedics department. We work really closely with the ortho department. There's no orthopedic surgery residency affiliated with our hospital. So we have a really close tie with them. If you're interested in sports medicine, if you're interested in spine medicine, we get an opportunity and a really firsthand pick at working with our orthopedics team, whether it be sideline coverage, sports physicals, or even just following them in their clinic or in the operating room. This is us kind of learning how to do what we call like the sports medicine trauma clinic, where we annually learn how to stabilize spine injuries on the field. So for those that are interested in sports medicine, we have a robust opportunities for you to volunteer with. Talking a little bit about our intern year. So as I mentioned, we have the level 1 trauma center, and that's one of the largest in the country. I believe it's like top 5 in terms of the public healthcare system. We have over 1,000 beds. You do get a chance to rotate there somewhat in your intern year. It's usually more for your second, third, and fourth year. Third and fourth year that you get to rotate there. In your intern year, you rotate over at our hospital west. which is also a level, I believe, level 2 trauma center. And that's where you do the majority of your internal medicine floors. You do ICU, emergency medicine. We have left some room for you to have the opportunity to do sports medicine and cardiology, whatever your interest is. There is an opportunity for you to pursue that as an intern. But like so many other intern programs, the focus is really getting your medicine down solid. And then when you come over to the rehab hospital as a PGY 2, 3, and 4, you'll have plenty of exposure to rehab, and we want you to be very solid on medicine because, as a lot of these other program directors and individuals have spoken about, there's a push to take care of sicker and sicker patients in rehab. So you really want to be strong on your medicine years. And I think we have a great medicine year. There's no call that you take during your internal medicine year or intern year, which is worth noting. But you do 1 month of night float. So you basically just swap your schedule from 7 a.m. to 7 p.m. and you go from 7 p.m. to 7 a.m. for a month. It's 5 days a week, and that's basically it. So that's as bad as intern year gets. And there's plenty of time to explore South Florida, explore your own personal interests outside of intern year. I personally felt like it was very manageable. I don't think I got really too close to the 80-hour work limit, with the exception of maybe a couple of months on ICU or internal medicine. But it's a very, very manageable intern year. And you're doing it alongside internal medicine, neurology, psychiatry, general surgery, anesthesia, emergency medicine, OB-GYN. So there's a lot of diversity in the training that you get and the people that you get to work with. It's a first-class facility. And, just putting an asterisk there, there's nobody really there that's competing with you for procedures. In terms of like an orthopedic surgery residency and whatnot. So if there's something you're interested in, there's definitely an attending or a mentor there to help you find it and pursue that. I'll pass it over to my esteemed colleague, Dr. Jerzak, our PGY3, to tell you guys a little bit about our PGY2 year and what we do over at the rehab hospital.
Hi, everyone. I'm Ellen Jerzak. I'm one of the PGY3s at Memorial. So I just completed the second year, which is where we get to go and we do mostly inpatient rehab. It's a really great experience. We actually do blocks that are 8 weeks long. So you really get to immerse yourself in each of the specialties in inpatient rehab. So those include brain injury, stroke, orthopedics, medically complex and spinal cord injury. And then outside of that, we actually get 1 month outpatient during our second year, and it kind of gets your feet wet in everything that goes on in the outpatient setting. So you get to go to the spasticity clinic, you get to do interventional pain, EMGs, see the prosthetic clinic and spinal cord clinic. So you kind of get a little taste of everything before going to third year.
Yeah, so I'll tell you guys a little bit about the excitement of third year. So once, just like Dr. Jerzak said, we do every single inpatient rotation in your PGY2 year. So you go into your PGY3 year and you've done traumatic brain injury, you've done ortho amputee, spinal cord, and that's done intentionally. So when you're in your PGY2 year, you are focusing completely on inpatient rehab and you are learning the core of rehab as best as you can. And that way, when you go into your third year, it's more of a focus on outpatient, and you're getting an opportunity to work with our spasticity clinic, our P&O clinic. We work a lot more closely with our interventional pain physicians, as well as our orthopedics department as well. You do EMGs in your third and fourth year. You have 2 separate blocks to meet what was the requirement. I believe it's been lifted since COVID, but we're well on our way to reaching those requirements. And even surpassing them based on your own personal interests. And that really goes with interventional pain as well. So we have our own PM&R pain attendings within our department. They're many of our mentors, and if you're interested in pain, they'll help you get hooked up with a research project to try to get published, to present at conferences, and to really pursue what your interests are. So I don't think, I'll speak for our residency when I say that, I don't think anybody is struggling to find procedure numbers. And more so than procedures, if there's something that you're just interested in, whether it be ultrasound, diagnostics, there's an opportunity for you, very much available. And that kind of goes more into like our PGY3 and 4 year. We We have a lot of extracurricular activities as well. We have an MS clinic. We have integrative medicine, where we work with our integrative medicine attendings, kind of looking at a more holistic approach to healthcare, not looking at the standardized way of prescribing medications for pain patients or for chronic cancer pain type patients, exploring various other avenues and ways to address that pain. So it's a really interesting way, and coupling that with your training as a physiatrist creates a unique opportunity to really provide something for patients that few other specialties and individuals can. I think that's been one of my personal favorite rotations. You also do your consult service, where I kind of mentioned about the level 1 trauma center. We work very closely with our neurosurgery department, and they'll even invite you to come into the OR with them. So we do our neurosurgery rounds, where we round closely with those patients. They're consulting us for more than just disposition, for bowel and bladder management as well. So it's an exciting rotation that actually Dr. Jerzak and I are on right now. I'll pass it back over to Dr. Jerzak to tell you guys a little bit about some of the logistics.
Yeah, so you can see some of our benefits and the salary listed on this slide. There actually was just a raise in the salary. So it increases, every PGY year. We do get 25 days of vacation time. That also includes your holiday days that are paid. We get all the, normal insurances, the health and the dental. One of the huge perks at Memorial is that we actually get free food and free parking. So that lets you save a lot of money when you're able to get breakfast, lunch, and dinner for free. And we also, at most of the hospitals, get to go into the doctor's lounge. So the food is really good in there. And then in addition to our 25 vacation days, which they actually just increased, we also get 4 additional half days for wellness that you can take at any point if you just feel like you need a little bit of wellness in your life. If you want to go check out the beach for the afternoon, you can take one of your 4 half days to do that. And then in addition to the salary, we also get $1,000 of educational stipend every year. And then we also have a stipend for conferences. If you get a case presentation into a conference or any type of research into a conference, you can get that conference paid for. And you actually get an additional 4 days for conferences as well.
Yeah, I would second everything Dr. Jerzak just said. We are very well taken care of in terms of parking and food. Nobody's going hungry from our residency. Lost my clicker here. Sorry, guys. So there is an excess of activities to partake in South Florida, whether it be sports or whether you're more into the outdoors. This is our program director, Dr. Jacobs, fishing. He's an avid boater, and he's pretty much always out on his boat. He has a really fun annual Christmas party and an annual summer party where he invites everyone over to his house. We get in his pool. We kind of hang out. I would say pretty regularly, all of us at any given time are on the beach. I myself love golf. There's pretty much anything that you enjoy doing, you can find in South Florida. A couple of the residents, I think it was like 6 of us and our significant others, all joined a kickball team, which sounds like it was more recreational than it was, because it became very serious and it was a lot of fun. So it was a good way to just to kind of blow off steam after work. And I would say, to all of you out there listening, as so many of the other individuals have said as well, be proud of yourself for making it to this point. You're all incredibly capable individuals. You've already found your way to an amazing specialty, that being PM&R. And of course, we're not biased at all, but be proud of yourself. 4th year and these last couple of years of medical school can be a daunting process, but enjoy it. You're doing things for the right reason. Trust yourself, listen to that inner voice, and trust your gut when it comes to ranking programs. And when you're interviewing, put your best foot forward, and you guys will all do great. Dr. Jerzak and I are more than available for any questions that you guys may have. There's no such thing as a bad question. If there's anything on your mind, it's absolutely worth asking. So we're here to help if you guys have any questions. These are just a few more pictures of our family and our team here. I'll stop sharing my screen. Are there any opportunities? Yes, there absolutely is. So I'm glad you asked. So just so you can tell your colleagues, for like underclassmen, for like MS 1s and 2s, we might be able to offer like a shadowing experience, but absolutely, if you are a 3rd or 4th year medical student, we will offer full-on 2-week rotations or 4-week rotations. I'm happy to set those up myself personally, and I can cater that to what your interest is. If you want to do a mix of inpatient or a mix of outpatient, you want to do majority inpatient, majority outpatient. If you want to work with our ortho team, if you want to work with our pain attendings, we are so available. We're super excited for medical students to come in, and we're happy that we're tiptoeing our way kind of out of the COVID land. I'll say that with fingers crossed, that we can now do so with a little bit more freedom and flexibility. So by all means, I'll tell you what, I'll put my email in the chat right now. And you are more than welcome to reach out to me with any questions that you have, or if you would like to set something up, and I can put you in contact with the individuals to kind of do that process formally. Looks like there's another question here. Any communication barriers with patients if you don't speak Spanish? So it looks like a 2-part question. I'll answer that. So I moved to South Florida and I spoke literally 0 Spanish. It's no secret that South Florida has a very diverse community, and it's not even just Spanish. There's a lot of Haitian individuals. There's a lot of people that come from Europe. There's a big Russian community as well, a large Jewish community. It is a melting pot, which I think is what makes South Florida so amazing, is that there's so many different people. But yes, you will get better at your Spanish, whether you want to or not, living here. Like I said, I spoke no Spanish. I'm by no means fluent, but I'm getting there and I'm getting better and I'm trying. There's so much help in the hospital. There's translators that actually officially work for the hospital that you can just dial a number and they'll basically come over and help you. But there's also these like video chat translators now too. So it's something that you're going to just have to get out of your comfort zone about and accept that it's something that you just have to learn and get better at. But there's so much support there. I have never felt like I've, not been able to communicate with my patient. There's always somebody there to help. So, and the second part of your question was, have we interviewed accepted IMGs? Yes, to both of those questions. I think one of the things that really drew me to this residency and to Dr. Jacobs and Dr. Delgado is that they view the whole applicant. PM&R is a specialty where it's so based on you as a person. It's based on your personality. If you're passing your boards and you're passing all of your classes in medical school, we want competitive applicants, but I think more so than that, we want people that care. We want people that are going to show up every single day to work and be excited about what they do, that are choosing rehabilitative medicine for the right reasons. And that's something you can't fake. So whether you went to an IMG, a DO school, an MD school, we are open to all applicants and we will view all of them in depth. So that's a great question. Do residents often go into fellowship or private practice? So we actually just graduated our first class. We're a relatively young residency. And 2 of our 3 graduating class, we have 4 residents per year. So our residency is 16. Our first year was only 3 residents. 1 actually transferred due to personal reasons. But 2 of our 3 residents at that time matched into pain fellowship. 1 went to LSU pain fellowship and the other one went to University of Washington in Seattle. And the other one went straight into work in academia at WashU in St. Louis. So yeah, my class will be the second graduating class. Yeah, so I'll just kind of keep going down here. Let me know how I'm doing on time. 2 minutes. Okay, see that.
Yeah, I think we're pretty much kind of wrapping up, but
okay.
Really appreciate your guys' time.
Yeah, thanks guys. Feel free to reach out, okay?
Awesome. Thank you guys again.